Hello, my name is Katie Homan and I am a physical therapist. I am also a certified lymphedema therapist. So what I'm going to do in the series of videos here is going to go over different swelling disorders and different conditions that might be relevant to what you're experiencing currently. I also want to give you a bunch of treatment techniques and tips that you're able to do at home on your own time. So the first thing I go through typically when I see any type of patient with swelling is I like to look at their history. So the history is going to give me a better understanding as to how the swelling started. Were there any underlying factors as to why it started? Were there any issues with maybe this being kind of a hereditary swelling problem? So typically my pre-questionnaire for all of my patients would go through any surgical procedures that you may have had, any surgeries, whether it's even a skin biopsy can disrupt your lymphatic system. So all of that would be relevant. If you had cancer of any kind, if you've had any radiation or chemotherapy, that could also play into it. So that's something I definitely want to know. And then as far as your past medical history, do you have any cardiac issues? Have you had any blood clots in the past? Do you have diabetes? Any renal or kidney issues that you're experiencing? Any issues with a history of skin infection or cellulitis? Do you have any issues with your lungs? And then, of course, like I said before, any issues, any diagnoses of cancer. I also will go through your medications. Now, a lot of patients that I see with swelling, if it's been going on for a long time, and typically I say chronic swelling, meaning more than 3 months. So has your swelling been going on for longer than 3 months? Are you on any medications to help this? A lot of times doctors will prescribe diuretics or some type of water pill to help eliminate fluid within your body. And you'll find that you're having to go to the bathroom a lot more, but it doesn't impact your swelling significantly enough to make it now a non-issue. So I want to know what you're taking. Occupational and work demands. What's your job? Do you sit all day? Do you stand and move around? Are you on your feet all day? Are you having to do a lot of lifting and carrying? How physical is your job? That's something I need to know as well. And then I also want to know, how is your swelling impacting that? So if you're sitting at a desk job all day long, is your swelling a lot worse at the end of the day because you're in that position? And so those are a lot of factors that are going to play into this as well. Work isn't the only thing that's impacted with most people with chronic swelling. Your social life, your leisure activities, all of those things, your interactions with families, all of those things are going to play into the management of your condition. And so if you're watching this online video, I anticipate that you have a very busy schedule. You may not have a clinic nearby that has anyone that specializes in swelling or lymphedema, so that could be a factor as to why you're not seeking treatment from a therapist for this condition, or you're simply just really busy between work and family and your lives. Things have to continue, and so sometimes it's hard to take a break and be able to get the treatment you need for this condition. If you've had any treatment before, what was the outcome? I'd be curious to see what kinds of treatment you have done. Have you had lymphedema treatment before? Did they do all of the components of it? And so that will play into it a lot. So if you have had treatment before and it did show results, then you really should be getting back to those basics as far as the different techniques that the therapist or possibly doctor has shown you to do to manage your condition. Sometimes we let things kind of fall to the wayside. So I think getting back into those techniques and different tips that you were using when you were successful on a program is definitely important. If you've never had treatment before for chronic swelling, then this is going to be very enlightening and very helpful to you as far as knowing what to do. That's pretty much it as far as what I look for is in my pre-exam when I'm face-to-face with a patient. That's what I want to know. A few things to keep in mind as far as contraindications or things that could impact these type of treatment techniques. Anyone that has renal issues or cardiac issues, you are at a higher risk of having complications for the fact that a lot of these techniques we're trying to get rid of fluid. So if you are pushing fluid into your kidneys or through your heart and you already have issues in those organs, then it's going to be a lot harder on your body to process that fluid. So what I would recommend is make sure if you have congestive heart failure, if you have chronic renal disease or something like that, that you get with your doctor, you get with your nephrologist or your cardiologist, and you make sure that you are a good candidate to be able to do this on yourself. Because the last thing I would want would be any, increased risk to any other areas of the body. So definitely clear this with your doctor before starting any type of treatment or technique at home on your own, just to make sure everything is going to be safe. So I'm going to start by going through what your lymphatic system is. What does it do? So most people know your lymphatic system as the lymph nodes, and you can feel when you're sick, you feel swollen lymph nodes around here, around your neck. You can feel them around your groin as well. And the reason for that is those lymph nodes are what process different things in your system. So it's part of the circulatory system, and they're found throughout the body. So not only, your neck and your groin, they're all over, all the way down your arms, down your legs, up into your head and your face. So the purpose of the lymphatic system is to remove excess fluid, to remove any precancerous cells, and to remove bacteria, toxins, and other viruses as they pass through the lymph node to return into the venous system. So when you're sick and you get those swollen lymph nodes, they are processing and moving, trying to remove that bacteria or toxins from the illness you're experiencing. So what the lymphatic system does is extremely important as far as processing and moving fluid. And it's basically referred to a lot of times as your body's own natural antibiotic. So it's your body's own way of processing and moving all of these bad things that are in your circulatory system out. So if you have any disruption in your lymphatic system, that is when you will see this swelling or this pooling of the fluid not taking place. So lymphedema is a swelling of a body part, and it's most often an arm or a leg. It can be both legs, it can be both arms, it can be in your abdomen, your neck, it can be, in various parts of your body, but I mostly see it in the arms or the legs is where it's most noticeable. But lymphedema is basically a protein-rich accumulation of fluid. So unlike a typical ankle sprain, I'm playing soccer, I sprained my ankle, it's swollen because there was trauma to that particular area. So I can ice it, I can elevate it, and I can help get the swelling to go down. That is comprised mainly of water. So by elevating the limb, the fluid is going to come down just with gravity, helping it out. And then also the ice is going to vasoconstrict your blood vessels, so basically close them, make them smaller so that they're not allowing, more blood flow and more fluid into the area. Now with lymphedema, because it's protein rich, you can get rid of a lot of the water component of the fluid, and that's what a lot of the diuretics and water pills will do, but it's not getting rid of that protein that is in that particular area. So the techniques that we use in lymphedema treatment is going to help move that protein. There are two different types of lymphedema. So you have a primary lymphedema and then you have a secondary lymphedema. So primary lymphedema are cases where there isn't an obvious cause. There's no trauma, there's no major surgery, and it's pretty much categorized as hereditary. Not always, but more often than not, it's hereditary. So you may have a relative that has had some type of swelling before, and it usually develops pretty early on. So you'll see it like in your teenage years, and it's more common in females, and it is more prone to developing in the lower extremities versus your upper extremities. Now, secondary lymphedema, which is most of the cases that I see as a clinician, are going to be caused by some outside force. Okay, so some outside factor is causing the disruption of my lymphatic system from working appropriately or perfectly. So it can be an injury, it can be removal of lymph nodes. So if you've had a mastectomy and they remove, lymph nodes around your armpit, your neck, that is going to lead potentially to some type of chronic swelling. And then anyone that's had those removed is also at a higher risk, because now if you don't have all of the lymph nodes you need to process fluid, then one other area is going to have to pick up the slack, if you will. So if it doesn't pick up the slack, then you're more susceptible to developing lymphedema down the road. So trauma is a big way that you can have lymphedema start. So something as simple as I run into my coffee table at home and slam my shin into it. That can disrupt my lymphatic system just because it's so superficial. So if you think of the muscles that you have in your legs and the skin, and it's right between there. So of course any major surgery can do that. Having a knee replacement, you're disrupting that entire lymphatic system, and it's not going to be back the way it was prior to the surgery. So the body has to either reroute or figure out, how to deal with the fluid, or it's going to start pooling. So secondary lymphedema isn't something, if I run into that coffee table, if I have a knee replacement, it's not something that's going to happen immediately. It could take weeks, months, even years. I've seen it develop years later. And you can track it back to, that's the only surgery I've had, that's the only issue I've ever had in terms of disruption of my lymphatic system. So that is definitely a factor to think about. Any type of surgery, prevention is always key, so always taking a lot of these techniques you're going to learn into account and being able to utilize them, whether or not you have serious swelling or just kind of a mild case of it. So as far as treatment, I'm going to give you a rundown in the next video. I'm going to give you a rundown of what we do in the clinic, and then I'm going to go into more specifics of things that you can start doing at home to make this successful without you having to leave the comfort of your own house.